Hi, my name is Professor Derek Willis and I'm an adult palliative care physician and I work in Shropshire. I'm a medical director of a hospice there, but also as part of my job I work with the local neuromuscular centre. So I've developed several years experience now of working with patients with Duchenne Muscular Dystrophy, but also the wide range of muscular dystrophies that people suffer from. Now the first thing to say is, and the take-home message is, don't panic. Because your perception might be that when we're talking about palliative care that all I'm going to talk about is death and dying. And actually there's loads of other things that we in palliative care think that we can actually offer people who are adults who are suffering with Duchenne Muscular Dystrophy. So, two things that people generally think of when they think of palliative care. The general public, as soon as you use the word hospice, because people probably wouldn't know what palliative care is, they would think that hospice is a place you go to die. Now, that's probably true in the 80s, but now where palliative care has reached is that we're trying to have more of a positive aspect, where most of the people that we have in a hospice are those people who need symptom control. So what we're trying to do is to improve people's quality of life and get them to live well with a disease that they know is life-limiting. The second thing that I'm guessing for people who've got experience of Duchenne Muscular Dystrophy, either as someone who has the condition or a carer or a family member, is what children's hospices do, which is a really important role of providing respite for families. And that isn't something that adult hospices generally do. A lot of the treatments that are there for Duchenne Muscular Dystrophy mean that people are living longer. So people like me are now starting to see people who have Duchenne Muscular Dystrophy. So it's raising challenges about what it is that we can do to help support families and patients who have this. And the North Star document that's been written for adults has palliative care in that. And I've been part of the team that have helped to write that. So, if your neuromuscular team suggests that an adult palliative care physician becomes involved, I think there are four things and four categories that it might be that they're going to be involved or be able to help you with. So the first thing is symptom control. Now we know that a lot of people who have Duchenne Muscular Dystrophy, particularly in the later stages of the disease, suffer with symptoms, pain in particular, but also there can be gut problems, people can feel nauseous. That is the kind of thing that is bread and butter to a doctor like me, where most of what I do is to give medication and alter wheelchairs and environments to help people to improve their symptoms. So it may be that your neuromuscular team is asking for someone like me to give advice about what symptoms people have and how we can improve them. So the neuromuscular team are experts in the disease process of Duchenne Muscular Dystrophy. I'm an expert in symptom control, but the person and the family and carers of someone who has Duchenne Muscular Dystrophy are experts in what it's like for them to have that condition. We're trying to treat symptoms. It's the three aspects that we're trying to bring together to help someone have a better quality of life. So one, symptom control. Number two, what we're actually talking about sometimes is providing spaces within adult hospices. So people who have Duchenne Muscular Dystrophy often want to meet together, and the adult hospice will provide you with a space. So we won't get involved, we won't do anything. We just provide our space for you guys or people with Duchenne Muscular Dystrophy to meet. And there are some hospices throughout the country that are starting to do this and are really enjoying doing it and getting positive feedback from users of the group. So it might be that you're being referred because there's a group in your area. And if not, it might be that you want to knock on the door of the local hospice to ask why they're not. So symptom control, secondly, a space to be, and thirdly, advanced care planning. What advanced care planning is trying to do is to say, it might reach the point where you're unable to tell us what you want, what your treatment priorities are if you go into hospital. So that's either because the condition has reached a stage where you can't, or you're in such pain, or you've got breathlessness and you can't talk properly. What an advanced care plan is trying to do is to write down what it is that you would want to happen, what it is that you wouldn't happen. So when you're in that position where you can't tell us or tell your family, we've all got a bit of paper that says, these are the things that I'd like to do, and these are the things that I don't want to do. So it's your written way of representing yourself when you're unable to verbalise that. So advanced care planning can be something that your team could do, but also could be something that palliative care doctors can help with. So I've done three things and I've not mentioned death yet. So it isn't just all about death. So the fourth thing is to say that there are some people who reach the end of their disease process and we talk about what their preferences would be for where they would want to die. Adult hospices Their focus now is very much trying to support people at home, and we will be able to provide carers and support for people to stay at home to support your family and you if you are someone who has Duchenne muscular dystrophy, if that's where you want to be. But there are some people who don't want to die at home, who want to be in a neutral space so that the home isn't somewhere that the remembrance of the death is there. And adult hospices can provide that safe space for patients to die in. So, I have mentioned death, it's part of it, but it's not all of it. We've got symptom control, we've got a space to be, we've got advanced care planning, and we've got end-of-life care. So, take-home message. If you get referred to a palliative care doctor, don't panic. It's not all about death. And some of this is us trying to understand what we as palliative care physicians can offer to the community that is Duchenne muscular dystrophy. Thank you so much for listening.